Let me see, what am I not? We introduce ourselves by saying what we're not. So I'm not an engineer, and I'm not an academic, but what I am is a business person, a person who's experienced in business, particularly in health. And what I do is I work together with the scientists and the researchers at Cranfield to help them to fund the research that they're doing and the vital ideas and innovations that they come up with. So that means that I can talk to people in industry and I understand their language, I hope, quite well, and then we can talk together and see if we can help them to achieve their aims and to bring products such as the one that Richard mentioned, to bring that forward to the marketplace. So I've just got a few ideas here, and I'm not sure we're going to come to any conclusions in the next sort of 10 minutes while I'm speaking, but a few ideas, and some of them are sort of redolent of what we've heard during the day already. But I've turned things round a little bit because I sort of anticipated that there would be some fear about technology, because it's a big word, and telehealth, because it wasn't, or it still isn't quite certain what that is. So I've said, how can care be made less remote? By using things like devices that can help to get better care. So that's by way of starting. And because I'm a businessman, I've come at it from thinking about a financial point of view. Let's see what the next slide says. Commercial influences. So if we're to bring some of these things to patients of today and patients of tomorrow, we're going to have the money to fund the research and the money to bring them to the market, and that will normally come from private businesses or even huge global public businesses. And this is where one of the ideas is actually being debated publicly at the moment. Richard's spoken about the increase in the number of people over the age of 60 and how huge that's going to be over the next 20 to 50 years. It's actually a huge and increasing responsibility. And I've said a huge and increasing market, question mark, because the commercial people will look at it and say, that's a marketplace that we want to be in. Let's care for the elderly because there's going to be loads of them and we'll make lots of money as a result. So that's an issue which we need to think about, and as I say, is currently being debated, I think, more and more publicly. It means investing in things like the fabric of society, the places where people live, the housing that's available for people over the age of, well, whatever age they are, but if they need to be given a house to live in, that's a financial investment. If they need a home, which is a little bit of a warmer thing, a home where they can feel as though they belong and where they actually have a place which is their own, that's something with a little more than just a house. And lastly, they may well need health care during part of their stay, or maybe even if they're suffering from a chronic disease, a long-term disease, they'll need the investment in that. The problem is that large organizations, yes, they're there to please their shareholders and to make money by bringing valuable ideas into use, choosing my words very carefully, but at the same time there's cost containment. So they know that the less the cost is, the more there is, the more profit there is at the end of the day. So that's why it's a huge responsibility. And there are people costs, which are normally the highest cost to any organization. Then there are the assets, which you could call the homes that people live in. And then there are the technologies. And the arguments that we've heard so far argue from the point of view of the technologies saving money. What we don't want people to do is to think that that's the only reason we're doing it. So my philosophy is we should be looking for ideas that actually improve the quality of care, number one, and then if they are attractive to the NHS or to the social care organisations because they help to save costs elsewhere, such as in salaries, or needless costs elsewhere, then they are a valuable proposition. Who pays? Who's the customer? Is it ourselves when we go to live in one of these homes, or when we take advantage of some of these technologies, or is it the NHS, or is it social care? And is it the young people who pay for it, or does it come out of our taxes as we earn money as we grow older? And how much do we pay, and what do we get for our money? And that, I think, is still also in a formative situation. And how do you, somebody said this morning, how do we know which is the right value for money for something we're buying? Do we have to go onto a computer? Do we have to use the internet, compare one against the other, tick lots of boxes, see what we're getting? Rather like, go compare for somewhere to... And the statement at the end there, should anyone make profit out of care for the elderly? It's a thought that's come from just a very recent article this last weekend, and it's on the internet. I've brought copies as well, actually, today. It's an interview with the writer, Diane Athill, and she's just moved into a care home in London, and she loves it. She's singing its praises, having been through this awful situation of having to empty the home and empty the house and get rid of a lot of her own possessions over the years and then move into a home. But she's finding it a marvellous place, that's the word she uses there. And the reason she says it's marvellous is because she can detect a certain goodness about the atmosphere in the home, which is a wonderful thing. But unfortunately, it's definitely not the case across the board, because we know about about what's been going on in certain homes and hospitals, but also in terms of the financially led care homes. The biggest one is in deep trouble at the moment, and we know that, so it's raised the debate even further. And she actually says that you don't set up an old people's home as a private company unless you think you're going to make a profit. And you can't make money out of old people. So this, as I say, needs to be discussed, needs to be debated, and needs to have government-led regulation or legislation so that the different aspects of caring for the population as they grow older are looked after financially in the right way. Attitudes to aging is another thought that is in my mind, and it's great to have different age groups here today and to have chatted with a lot of you. I think that as you grow older, it seems that sometimes people get a little bit more isolated. I think partly because they don't want to be a burden, and partly because we don't do very much to encourage mixing in the way that has happened here today. So is it the young versus the old, or shouldn't it be more of us all working together and exchanging our ideas? So in care homes, and we are working with one care home at the moment, which is helping us to inform what we're doing. And in terms of some of the ideas that we're putting forward, ideas that can help people to socialize more are, right up there. Technologies that not only can treat a condition, but can help people to talk to each other is a fantastic way forwards. The role of the family is often underestimated, but it's only when you think of how a family operates that you begin to realize the power of the family in situations like this. And reducing stigmatization, if you like, of the old. I don't know if anybody's noticed recently on some of the BBC programs, I think there are at least 2 at the moment where there's a patient suffering from dementia actually featured in the episodes. And it's that kind of thing which brings it more into the open and helps people to understand the issues. attitudes to aging, well, it does affect us all, so it is personal, and I think that's one of the thoughts that I wanted to put across. A couple of things here on the slide. As the age group moves up, ability goes with it. It isn't that we all age to become old and then live for a long time after that. We actually are fitter for longer as well. And as healthcare gets better and our lifestyle hopefully gets better, including diet, we should be preventing a lot of the chronic diseases, the long-term diseases, from happening. So on the left there, you see a bunch of athletes. There are 3 or 4 in that group there that are over 60. And that's my running club, but it's also an athletics club. And we have what's called a Vets League. And on Monday night, I'm going to be doing some high jumping for them. I can't jump very high, particularly now I'm not 30 anymore, or even 20. But it's all relative. I can get some self-esteem from jumping a good height for my age. And I think the only point I wanted to make here is that everything's relative, and I think it's important for people as they get older to feel as though they're valuable and to feel as though they can achieve things. The guy down there who's doing pole vault, he's in his 50s, and he's learnt to do the pole vault. We have a runner in the club who's 75, and he still does marathons. Fit as a fiddle. On the right, well, in the middle, you can see my mother, who is 85, and this is a family occasion, and she's absolutely looking great there, and she's moving into sort of dementia. She's beginning to lose her short-term memory, and at times she won't recognize us, and at other times she will talk superbly about things that happened 20, 25 years ago. And there she is, looking great, in amongst her family, with the family offering her lots of support. And that's my father there giving a speech. It's actually his 85th birthday. And he's looking after my mother now full-time, with a bit of help, but at home with help from my sister as well. And they're all giving support. Funny thing about that is, in the middle there, the glass of champagne she's holding, she really shouldn't be drinking. That was my father's, and she picked it up to take a swig, and good for her. So the pressing causes and the role of technologies are homes that I've mentioned, but they need to be safe, and no doubt the gizmos that we develop will be in the home to make them safer for people. Good quality of life and the value of life, including self-esteem, with lots of social interactions. Appropriate nutrition and hydration, drinking enough water. It's so vital that people, particularly as they get old, continue to take on board enough water. And for young people, you know, kids, eat the right stuff, because that will avoid you getting a chronic disease later. You know, diabetes is one of them that you can get as you get older as well as when you're young. And it's a serious problem. Places like China are going to have huge rates of diabetes because they're eating all the burgers and all the crisps and all the nasty food. Bit of preaching. Talk to Jamie Oliver, he'll tell you. Living well and safely with the diseases of aging, that means everything that we can do to help those diseases and to make sure that our population is kept safe. Mobility issues, technologies required there. I've mentioned diabetes. Cardiovascular disease, heart disease, or peripheral vascular diseases, poor blood circulation, chronic obstructive pulmonary, that's breathing difficulties like asthma or bronchitis. They're all areas where the technologies can significantly help. And last of all, in neurological disease or in dementia. So I'm going to stop because I probably ran out of time about 10 minutes ago, Jim. But hand over to you.